only 46 newly confirmed cases nationally in the past 24 hours to 12 noon today, bringing the total number of COVID-19 diagnoses in Australia during the pandemic to 26,607. New South Wales reported 6 new cases overnight. 1 was overseas acquired and was in hotel quarantine. 5 people were locally acquired and contacts of a confirmed case or in a known cluster. In Victoria, 37 new cases of COVID-19 were reported. 16 were locally acquired and were contacts of a known confirmed case or a cluster, and 21 remain under investigation. In Queensland, there were 3 new cases, all of which were locally acquired and contacts of confirmed cases or known clusters. There were 6 new deaths reported overnight from COVID-19, and 803 people have died from COVID-19 in the current outbreak. There are 151 people hospitalised, and 15 of those are in intensive care. Now it is clear that those numbers are continuing to improve nationally, and very pleasingly the numbers in Victoria continue to improve. Without wishing to steal the thunder of my good friend and colleague, our Chief Nursing and Midwifery Officer, Professor Alison McMillan, who will have a lot to say about this next week, I did want to share with everybody that next week is going to be Nursing in the Community Week. Australia's nurses are playing an extraordinary role in the fight against COVID-19. When I was assisting and developing the plan for COVID-19 response at Canberra Health Services very early on in the pandemic in February, our community nurses out in our community nursing practice centres in Western Creek and Belconnen were amongst the first nurses in Australia to be doing testing for people with COVID-19. And so right there at the front line they were from the start, and have continued around Australia to play an extraordinary role. Of course, the work of nurses in Australia goes way beyond COVID-19 at the moment. They continue to care for Australians across all walks of life and across all stages of life. As I said last week on Wednesday, or earlier this week on Wednesday, it is deeply concerning that healthcare workers have made up more than 15% of cases during Victoria's second wave, and of those, more than 70% of COVID cases from hospitals, healthcare workers who have been infected in hospitals, have been nurses. And in the second wave, of course, in contrast to the first, the majority of these infections have related to workplace exposures. That is why we're working so hard with the state and territory governments and hospitals and health services to support nurses and indeed all healthcare workers so that they can go about their work caring for Australians as safely as possible. We're continuing to support hospitals in their efforts to protect their workers from COVID-19, including the provision of vital personal protective equipment drawn from the National Medical Stockpile. And since March, more than 73 million masks, a combination of surgical masks and particulate filter respirators, the so-called N95 or P2 masks, have been dispatched from the stockpile to support healthcare workers, aged care workers in states and territories, and also to support the disability sector. And with those comments in mind, I've got 2 people on the phone today, and I'll start with Tegan.
Tegan can't actually hear you currently,
so okay.
Maybe go with the next one and I'm going to ask the question for Tegan.
Sure, thank you. Dana.
She might be a problem with the line.
Dana, are you able to hear me there? Okay, looks like we've got a little bit of a problem with the phones, but I can take Tegan's question from the cameraman.
Sure. So I'll start with a question. I think there's been reports that last year there were actually higher mortality rates in the aged care sector. So can you comment on that at all? Anything to do with aged care, I guess would be what I'm asking you.
So I think Tegan's question potentially relates to the mortality rates, or let's humanise those terms a little bit, the number of deaths from other causes, particularly influenza, in previous years compared to COVID-19 this year. I hope I've paraphrased that question okay, Tegan. And it is the case, certainly, that we can have very, very significant influenza seasons in this country. The last one that I remember of extreme significance was 2017, when we had that vaccine mismatch between the vaccine and the circulating influenza strain. And it is absolutely the case that many Australians in aged care lost their lives to influenza during that year. Because viral respiratory infections, whether it's influenza or whether it's COVID-19, have a significant impact on the elderly. And we know that COVID-19 is a particularly wretched virus affecting our elderly, affecting those with more than one medical condition very, very severely, and potentially, as we have seen during the second wave, leading to deaths. Now, the difference, I think, it's not our business to be comparing directly the numbers, but there is a difference between a bad influenza season and COVID-19. And that is, of course, because with COVID-19, in an attempt to stop its spreading around, to family members and to others within aged care facilities, people need to be isolated. They need to be in personal protective equipment, and sometimes they haven't been able to see loved ones. And if you look beyond the numbers, then that is what is particularly cruel about COVID-19, and why we have to work particularly hard to do our best to keep COVID-19 out of aged care facilities. This question, to wrap up, is related to the release of COVID-19 infection data in aged care, which is on the Department of Health website now, and does give a comparative analysis of some of those figures related to influenza seasons and also to COVID-19. And I think I've got Dana on another phone. Thank you, Jane. Go ahead, Dana.
Thanks, Dr. Coatsworth. My question was similar, just on that data about the drop in influenza deaths this year. The aged care deaths have been largely centralised in Victoria. So would you say that it would be misleading to extrapolate from that COVID somehow poses less of a risk than influenza to our elderly Australians?
Yes, I think you're right. I think that would be misleading. We can't make that comparison. They're both potentially fatal in elderly Australians. They're both potentially fatal in residents of aged care facilities. And it's a good opportunity, I think, to remind ourselves that aged care workers and providers have been managing outbreaks of infectious disease before COVID, be it influenza, be it norovirus, which is a gastrointestinal disease. So to an extent, the systems and processes and infection control processes we need in place are not particularly different to the ones that would control influenza and COVID and norovirus and other infectious diseases. But what we know is the implementation of those infection control procedures has to be near perfect, both in the residential aged care setting and also in hospitals. And that is why one of the very early focuses of the Victorian Aged Care Response Centre was supporting facilities and providers with infection control training through Australian Defence Force and AUSMAT flying squads during the peak of the COVID second wave. That is why the HPPC has insisted, or in collaboration with the states and territories, to provide liaison officers into state and territory health emergency coordination centres in the event of even a single aged care outbreak. So we can monitor and partner and make sure that the extent of aged care outbreaks is not as great as it was in the Victorian second wave. And perhaps another question, Dana, if you like.
Oh yeah, just on the Queensland border, there are more stories coming out today about people desperate to see loved ones, including, sick and dying. Have you had any conversations with your Queensland counterpart about this, about potentially having some compassionate grounds there?
Well, we do have conversations with our Queensland counterparts all the time. Of course, as the Deputy CMO, I tend not to directly talk to Dr. Jeanette Young, but I know that my colleague Michael Kidd has spoken to Dr. Young, that Professor Paul Kelly did prior to him when he went on leave. And look, the substance of those conversations we have to remember is respecting the role of the Chief Health Officer in every state and territory to make these decisions. And when these decisions do have effects, as they are, then we are asking on some occasions for exemptions. But this is a very challenging situation for border towns in between Queensland and New South Wales. It is a very challenging situation, I know, for Dr. Young, who has to assess all these exemptions, and clearly it's been challenging and deeply distressing for the families that have had to either not see loved ones or have to quarantine before seeing loved ones. These are the effects of having borders closed. And we all have to consider the balance between those border closures and the effect that they're having to keep out COVID-19 from a state or territory, and whether that balance is actually achieved. Ultimately, that is a decision for the Chief Health Officer and the Premier of Queensland. Okay, and given that we've only got people on the phone today, I'll wrap that up. Thank you very much.